Hello, diabetes is a metabolic disorder, as you know well, concerned with carbohydrate metabolism. Even though it is concerned with food, how we handle the food will definitely decide whether you are going to be diabetic or not. In the sense, if your activities are good and whatever you eat, you utilize, definitely. Either you can postpone diabetes if you are prone for diabetes or a pre-diabetic, or even you can avoid diabetes. So food plays a very important role, but more important is how you use the food, utilize the food, activities, exercise, lifestyle, etc. Today we'll talk something about a nut which is being discussed for years together by many. A nut which is a bit costly, but everybody talks about the nut. And actually it is not a nut, it's a seed, almond. We'll talk something about almond and diabetes. Almond, as I said, it's a seed, it has got a skin. And whenever people talk about almond, they give importance only how to take this almond. Soaking it for hours together, overnight soaking, the next day removing the skin or peeling it and taking it. The concept and the argument and the discussion about this is if you take with along with the skin, then the nutrients you will not get fully. So that means what? A food which is taken in a different forms will have different effects. What does it mean? A raw almond and a soaked almond. An almond with a skin, an almond without a skin. What is the difference? So the form of food, any foodstuff we take will definitely alter or what you get from that food. If you take a fruit, whole fruit will have a different effect in you than a juice. Always it is better to have a whole fruit. Why? We'll discuss later in a different video. Again, I'll give you a very good example. Potato. You take potato, raw potato, then the blood sugar, very meager rise will be there. You have heard about glycemic index. It is nothing but the fastness, the speed with which the sugar rises in your blood. If a carbohydrate food is absorbed very rapidly, the rise in sugar is very fast, very rapid. This you call it as high glycemic index food. So you have high glycemic index, low glycemic index, and medium glycemic index. A potato which is taken raw, the glycemic index is nil almost. That means it will not rise the blood sugar. Half boiled with the skin, it will have 50% of its glycemic index. Fully cooked, smashed potato made into a paste, if you take that, the glycemic index is almost near to glucose, 90%. So the form which you take food will definitely decide how fast or how much sugar is raised in your blood. Here also same case, soaked one, raw one, peeled one, etc. But this topic, what we talk today is about almond and diabetes. How it is related to diabetes. If it is helping diabetic people, in what way? We will see in this. I am Dr. BALA'S. So I told about soaking and peeling. What really happens when you peel or when you remove the skin in almond? What does this skin contains? The skin contains a substance called tannins. When you remove the skin, you are removing the tannins. Why? The tannins interfere with the absorption of all the nutrients. Is that the only reason? No. When you soak, it becomes a bit softer. It is easy to chew. It is easy to digest. So if you take a raw almond, it's the hardest nut. Very difficult to chew it, to bite it, to make it into small pieces. It is very difficult. So you don't spend much time in making it a very small pieces. You swallow it, and many time even after hours of eating almond, the undigested almond remains in your stomach. The almond is not completely absorbed in a short time. This is one of the concepts utilized in diabetic. If it is taken with food, if this almond delays the absorption of the food and delays emptying of the stomach, then naturally, when it delays the absorption of the carbohydrate which you are taking, the rise in sugar is also delayed. There is no sudden rise if you take almond. The pancreas need not produce more insulin in a shorter period of time to reduce the rising sugar. That is why this study, which was done, used only raw almond and not the soaked and peeled almond. So, as far as almond is concerned, now our point is, are you using the almond for the nutrients it has, or as a supportive therapy like for diabetics? Now, our aim is in diabetes, how to take this. So we are not worried about the absorption of all the nutrients. You can get the nutrients from some other source. Here, how to use almond in diabetes. They did a study in Asian Indians to know the effect of almond and blood sugar. This study went on for 3 months, around 12 weeks. And what they did, they gave about 30 grams of almond for all these participants. They chose people, pre-diabetics, obese people, etc., people who are in the edge of getting diabetes in future. You call it pre-diabetic. And one of the reasons for pre-diabetic is insulin resistance, of course. They're not able to use the insulin because of their weight and something like that. So they choose all those people and they give 30 grams of almonds just half an hour before each meal, breakfast, lunch, and dinner. And they observe the result. After 12 weeks or 3 months doing like this, 25% of the participants became normal. The stage of pre-diabetes have reverted to, and it has been proved. Of course, they chose Asian Indians and did the study. Now you have a solid proof that almond can help in diabetics, especially in pre-diabetes. Or in diabetic, it may help as a supportive therapy along with medicines. Now the question is how? How does it help in diabetics? How much almond should be taken? In what form it should be taken? What are the conditions to get the fullest benefit of almond? We'll see that. Number one is if a food, what you are taking along with carbohydrate, if it prevents the absorption or delays absorption, definitely it is going to help. So in that way, it prevents the rise of blood sugar by delaying the absorption. That is one. Second thing is, after all, the one hormone which helps is insulin. If this has the capacity to stimulate of insulin, definitely it is going to reduce the rising. A food reduces the insulin resistance and makes the body use the available insulin, that is, increasing the insulin sensitivity. This will help in diabetics. Apart from this, if a substance, if the food stays for longer time in your stomach, then the feeling of hunger is reduced. You will not eat again and again, which will increase your sugar. So these are some of the possibilities that a food can help in diabetics, either in preventing the rise or in reducing the rise sugar or in utilizing the insulin available. These are all the ways by which a food can help in diabetics. We'll see how this almond will help in diabetics. Giving almond half an hour before each meal, you call it pre-loading. Your real load is your food, the breakfast or lunch or dinner. So this almond becomes a preload. So they gave about 20 to 30 grams half an hour before every meal, breakfast, lunch, and dinner. The first thing, the mechanism is when you give this, the level of insulin increased half an hour earlier when you compare with a 75 grams of glucose. The release of insulin was 30 minutes earlier than the usual release. If you talk about insulin, see, when you take a carbohydrate food, the insulin release happens in two phases. The first phase is you have a stored insulin. When the sugar starts rising fast, this stored insulin is released fast to prevent the rise of sugar beyond 140, what you call it as the postprandial level, highest. Once it has achieved that, the next phase of release starts. This is called a maintenance phase. So it prevented the rise of sugar, blood sugar level. Now it wants to maintain that level. So you have two phases. So when you take almond, this stored insulin is released very fast, half an hour earlier than the usual release. Now you are going to take a breakfast or lunch or dinner. That is a load. This release of insulin half an hour before is called a pancreatic pump actually. The pancreas pumps the stored insulin into the system. The rise is prevented because of this pancreatic pump. This is a latest finding about almond. But remember, the almond was given not soaked and not peeled one. 30 grams of almond contains about 3.5 grams of fiber. The fiber increases the viscosity of the food that you have taken. It mixes with the food. It makes it more viscous. Once it becomes viscous, the body finds it difficult to absorb it and difficult to process and digest it, to convert it into your glucose. In fact, delays the absorption. It delays the digestion by delaying the absorption. So fiber also helps in preventing the sudden rise of sugar in almond. It contains a very high percentage of monounsaturated fatty acids. This fat, it takes a lot of time to get digested. Second, the fat gives a sense of fullness. You won't feel hungry. Urge to take next meal is delayed. In that case also, the rise of blood sugar is prevented. So fat helps in that way. That too, these are all good fats, monounsaturated fatty acids. The third point about protein. The protein also takes time to get digested. So that also helps in preventing the rise of blood sugar. And you don't feel hungry. Then almond has high amount of zinc, magnesium, etc. Zinc is very important for two things. One is insulin production, synthesis, zinc and magnesium. They increase the insulin sensitivity of this body cells. That means they reduce the insulin resistance, especially in obese people and pre-diabetic people. So even though you have more insulin in these pre-diabetics, they were not utilized, but this zinc and magnesium helps in utilizing the available insulin, thereby reducing the blood sugar level. These are all some of the ways and means by which almond helps in diabetic people. And the important point in this study is the almonds used were not soaked, the skin was intact, that was taken as it is. And apart from that, when you peel, you have more of antioxidants in the skin of almond. You are losing it. And flavonoids, which are very much useful in reducing the bad cholesterol, LDL level and all, that is also lost in that skin, or the fiber content is also reduced when you take out the skin. So that is why they used the raw almond. Even though soaking and taking away the skin may help in getting all the benefits from almond, our aim in this study is not to get all the nutrients from almond, but how almond can help in diabetics. They are not bothered about the other nutrients, which you can get it from other diets, other foodstuffs. But this benefit of helping diabetes is more important than getting all the nutrient from the almond. How much almond should be taken and how when to take is the next question. They used about 20 to 25 almonds half an hour before every meal. At least we can take 5 to 6 almond half an hour before each meal without soaking, without removing the skin. Definitely it is going to help. It's not substitute for a treatment, but it is very good for pre-diabetic people, in which the study they conducted, no, 25% of people reverted back to normal, all pre-diabetic people. So that has been proved. So people who really want to postpone or at least reduce the number of medicines you are taking, the quantity of medicine you are taking, this can be a supportive therapy. It may not be the principal treatment for diabetic, but it will definitely help and support you if you are a pre-diabetic or even a diabetic. Don't stop medicines and taking this, but at least it can help you. And this is the latest finding which I wanted to share with you about almond, and it is a proved one. And we can meet some other time with some other topic. Till then, bye. Thank you.